Welcome to Gamble with Brandl. Today we have a patient with type 2 diabetes and is on metformin and exenatide. And the patient is also on an insulin regimen on glargine and lispro. And we are given here some measurements throughout a couple of days, different times during the day. And we are asked to adjust the insulin dose. So how would you change this insulin regimen based on these measurements? And here you're given some options. So let's look at the measurements of the patient. So what do we see? So pre-breakfast, which is our fasting glucose measurements. So the goal for fasting is usually between 80 and 130 milligram per deciliter. That's our fasting glucose levels, what we want to have. So when we're looking at that, that's pretty low. That would define as hypoglycemia. So there's definitively some adjustments needed. Too low. Then all these other 2 hours after a meal, pre-dinner, bedtime, when we're looking through them, so generally when we are measuring, we measure 2 hours after the meal, and we should be below 180 for our other measurements during the day. And they seem fairly high, so most of them are in the close to 200s and are above 180. Just very few are below 180. So there's also some adjustments needed. So the patient is on a lispro. This is a short-acting insulin that looks something like that. If we have here plasma insulin levels and here a timeline. So this rapid acting, they have this rapid onset and then also offset. So this would be lispro, quick peak, but then also a quick duration of action. And then the patient is also on glargine. That's such a long acting one, a basal insulin. That's probably looks something like this. That's glargine. So it doesn't have a peak. And usually what patients are taking is glargine, long-acting ones, to really cover the insulin that we need throughout the day, particularly also through the night. And then you need something to give with the different meals to really counteract our high glucose during breakfast, dinner, and lunch. Okay, so the glargine, this basal insulin, this is what gets us also through the night, and that's mainly responsible for our fasting glucose values. So as we are reading off this fasting glucose values, that's what we need to adjust, these long-acting ones. And as we see here, these are too low, so we should lower glargine. If you are asked what to do with this patient, I would suggest somehow lower the glargine dose, because that's going to be the one responsible when you wake up in the early morning and measure. Now, for all these others, our rapid and short-acting insulins are responsible because we usually give something with each meal time, breakfast, lunch, dinner, and they're all pretty high. So what would we do? We would probably need to increase the lispro dose to counteract this high glucose readings. So when we're looking here, increase glargine, no, definitively not. Decrease glargine and increase lispro, that's exactly what we discussed. So that will be the correct answer.